Hello, everyone. Welcome to the second episode of our focus on value-based care delivery. Today, I have my co-host, Mr. Sumit Puri, and our esteemed guest, Mr. Viren Shetty, who has been building Narayana Health since the past 12 years. Narayana Health has underwent significant changes and grown significantly and expanded globally. So we're going to explore his deeper insights and how to really deliver low-cost care. Mr. Sumit Puri, could you please introduce yourself?
Sure. Welcome, Mr. Shetty. And I must say, I'm really privileged to share the stage with you. I have about 28 years experience in consulting, insurance and healthcare. I was PwC, then GE in various countries, then about 10 years in Prudential in various countries, again, Southeast Asia and India. And after that, Max Hospital CIO and Evercare Hospitals as Group CIO. Now I run a wellness company, Prana Wellness.
And I'm Mohit Mirchandani, your host for the whole series. Thank you for joining, everyone. So, Mr. Sumit Puri, would you like to lead?
Sure. So, Mr. Shetty, just to quickly ask you, your personal insights. Of course, you had a fascinating journey and you're leading expansion there. How do you stay productive? And if you were to probably also mention, how do you, kind of think out of the box and, your insights on leadership? It'll be great to get some insights,
Thank you, everyone. Great to be here. You've thrown a lot of questions at me. So the first one you asked about staying productive. For anyone who's been working in the healthcare sector, you have no option but to be productive. There's just a huge amount of work that needs to be done. There's so much of a massive challenge that we have to face. There's so many patients coming to all our hospitals every day, and there's just so many new and exciting things. So we have no choice but to be on top of things constantly. But a few things I've noticed that help is caffeine and trying to stay a little bit fit. So those two things I found just generally helps with overall productivity. And of course, nothing helps you be more productive than working with an extremely productive team, which I've been very blessed to have.
Right, absolutely. And any insights on leadership? What do you think are your key leadership values?
So the most important leadership value, this is something that the chairman of our group, Dr. Shetty, keeps saying, is that you're not just running a company, you have to run it with a sense of mission and get everyone to join you with the same sense of mission. So if you have an organization aligned around a purpose, it doesn't matter how good or how bad the leader is. Everyone is aligned around that this is the thing that we need to do. So from very early on, we were aligned around the fact that our mission is to make healthcare accessible to everyone across the country. And so it's relatively easy to lead people in that direction because they all agree that this is the way we should go. It would be very different if we had a different set of mission and then I was trying to convince them to do something different. So leadership is essentially around getting people to a common alignment around a shared vision and mission.
So nicely put. Put.
Yeah. So as in regards to leadership, how versatile have you been as a leader in terms of sometimes, because leadership you have to change your roles every second day. And what is the common problem you actually faced in your leadership roles?
Well, I obviously have to preface this entire stream of thought on leadership by saying that I come from the promoter family and working in an Indian company. And so a lot of the leadership roles I was given was essentially handed down to me with no discussion. And so the challenges that I face in getting people to listen to me are not going to be the challenges that 99% of the people you interact with and who listen to this podcast will face. So, but having said that, issues that come about is, I think the most important thing that happens is to look a little ahead of everyone else. There are, as I mentioned earlier on, so many challenges with this business and so many things you need to deal with on a day-to-day basis that you spend so much time looking down at the ground to make sure you don't hit any bump that you fail to look up and see what's coming around the corner. And a lot of the challenge I face is in the trade-offs between things that I know or think I know will come to hit us 5 years, 10 years down the line, but are not an immediate problem right now. Whereas we have a very large team that just has their heads down and focus on making sure that this car does not crash. And so for them to say, no, stop, let's just do things a little different, which don't make sense right now. There are certain business and strategic calls we made that absolutely make zero sense on a short-term perspective, but from a longer-term perspective, we ended up to be more right than wrong most of the time. So being able to pivot an organization around those axes is difficult for any leader, less so for me, but most leaders face that as a challenge.
Awesome. I think I must say, in this beautiful insights, I must say you mentioned leading with a mission, a sense of purpose, which is what the organization is aligned to, and balancing the short term and the long term. That's so critical to really steer the organization in the right direction. If I may ask you, we know healthcare costs are rising across the world. How do you at Narayana Healthcare manage balancing costs with the quality of care so well? If you could share some more insights on that.
Sure. In the earliest days of our inception, one of the easiest cost drivers used to be the cost of medicines and disposables. And the simplest way that we used to address those costs was by buying in bulk, standardizing our suppliers, and buying huge quantities and being able to have some savings there. But that has diminishing returns. Beyond a point, if you try to lower the price of your procurement anymore, you're impacting the quality. Beyond a point, if you are focused on buying the cheapest drug or the lowest cost disposable item, you don't end up being at the cutting edge, and your patients will say this is very low quality work. So it works up to a point. At the end of the day, we are in a services business, and service at the end of the day is delivered by humans. So the most important lever for cost optimization that we see in this industry will come from enhancing the efficiency of the people who work in it. Doctors, nurses, technicians, paramedics, patients, administrators, everyone in a hospital working today is easily wasting half to maybe 80% of their time doing non-productive things that are not relevant to clinical work. If you're a patient, a lot of your time is spent waiting. You're waiting in the parking lot. You're waiting for the doctor to show up. You're waiting for your medicine. You're waiting for your bill. You're waiting for the insurance company to clear that. That is inefficient. If you're a doctor, a lot of time is wasted also waiting. A lot of time is wasted doing administrative work, clerical work, filling up forms, waiting for things to happen. If you're an administrator, a lot of your time is wasted, again, spent in waiting for things that are otherwise not optimized in the best way. And so for us, we find that the new vectors of being able to reduce the cost will entirely go in reducing the waiting time, improving the efficiency. And what is everyone waiting for? It's just data. You're waiting for some point of information. A doctor is waiting to hear from the patient what his history is. A patient is waiting from the pharmacist to see whether that medicine is available in stock. The administrator is waiting for knowledge about when the next person is going to show up in the front door. So we've invested a lot in technology. We invested a lot in a homegrown system that reduces the friction. So at least we have a lot better visibility. Now, we still can't reduce the cost of what it takes to hire a doctor or a nurse. In fact, those costs will go up much higher than inflation, simply because that is the reality. An Indian doctor, an Indian nurse is a globally valuable commodity. Throughout the world, where you have in Western nations, people are not enrolling for medical school. In India, you have more and more people enrolling for medical school. We are the manpower supply to the whole world. And so the salaries will be globally competitive salaries, and that is a good thing. Most of my family members are doctors. I want them to earn more. A lot of people that you all know are doctors. So that the cost of a doctor, cost of a nurse cannot come down. It will only keep increasing. But the time that they spend in every hospital or clinic, if it's the most valuable time that they're spending, if they're not wasting it, then the cost per unit of work, or the cost per patient, or the cost per transaction that they do, that can come down. So that is one thing we feel will be the greatest driver of efficiencies and cost saving in this industry.
But that requires a lot of investment towards technology, I'm thinking, because to reduce inefficiencies, there needs to be EMR systems. To reduce inefficiencies, there needs to be triaging systems. So how much technology has been implemented as of now in Narayana Health to achieve that highest level of efficiency?
A lot of technology, and at the same time, not enough technology. An EMR is only as good as the doctor who's able to type the notes in a proper acceptable format or code it according to ICD or SNOMED or whichever thing that is clinically relevant for you. But if the EMR itself is an objectionable piece of software, if it's not in the form factor the doctor prefers, if he has to go to a desktop to access it, then it's not useful. And so for us, the technology is an investment. That is one thing that keeps growing. We have, at least we can say with some degree of confidence, one of the best EMR systems in the country. but it is nowhere close to where we need to be, because even the best EMR in the world is not as simple or easy to use as sending a text on WhatsApp or being able to use any sort of consumer grade software. And so as an industry, we have a huge amount of work and effort that needs to go into making it even easier to use, even better. And that's when you'll start to see a real transformative impact of technology on this industry. Because otherwise, right now, for us and for most industries, technology just layers on cost. It means I need to hire more people, more programmers, more systems, more people to help out. It's not helping things. It's just a fancy typewriter. But when we start embedding it into workflows, when you make the software more intelligent, when we start using the tools that are available to have the doctors type less, speak more, and spend more time with the patient, then it's useful, and then it can deliver the promise of less waiting and less time wasted.
Yeah, absolutely. I think I must say that what you mentioned is so true. And clearly, it's the marriage of people, process, and technology that actually does the trick. You have to make sure that technology is able to simplify things for the doctors, for the clinical staff across. And you're totally right. We have to reduce the non-value added work, make it much more optimal utilization of time, which is so important. And I must say, I'm absolutely amazed that the economy of scale that you have deployed at Narayana Health, I mean, I understand it's, the cost that you have, for example, in cardiac care, average cost is about $1,500 versus, let's say, cardiac care in the US, which is $123,000. So it's a huge difference. I mean, I must congratulate you for that. I'd just like to know a little bit more about the high volume, low cost approach that you take. Can it be scaled across various specialties without compromising on quality? If you could just throw some light on that.
Yeah. For some departments, it absolutely could be scaled. For others, no. So we have built in cardiac a focus factory, which is a huge amount of scale, a huge number of surgeons, a huge number of operating theaters, the country's largest pediatric cardiac ICU, one of the country's largest adult cardiac ICUs. And so we're able to drive more efficiency simply by having so many more people. And the thing about cost, where it can be $1,800, $2,000, and someone else is $120,000, it's that you don't break even at $1,800. We lose money on that. But because we have such large scale, you lose money on some, you make it up on others. Now, can be deployed to other departments? Of course. We run the country's largest bone marrow transplant program. We have a huge wing. We have about 25, 30 rooms for children with leukemia, for treating very advanced, skin cancers and other bone marrow related conditions. And that is run by a very tightly focused team. And so we're able to leverage the expertise across more patients. And that's how you get that sort of saving. But again, the bulk of the cost for a lot of these things are driven by things whose price will never come down. So bone marrow transplant depends on very costly medication. And until that cost comes down, there's very little that we can do. Similarly, in GI surgery, liver surgery, we run very large programs. And there is a point at which it is efficient to do so. But whether it's cost efficient is only to the extent that you're willing to lose money on some procedures to make it up on others.
But by cost, do you mean mostly infrastructure cost? Or is it inefficiency cost specifically?
See, the infrastructure is a one-time fixed investment, and that can be amortized over the next 100 years. Mm-hmm. As long as you are utilizing it all the time, the things that increase your cost are your variable cost. Salary, variable. The number of people you use, variable. Medicine cost, variable. Disposable, variable. And throughput is variable only to the extent of the more patients there are, the more revenue you generate. And so cost gets divided across a larger base.
So my question was, when you're treating patients in volume, specifically cardiac surgery, how do you standardize all the outcomes plus also increase the quality at the same time reducing the cost, which is equal to value technically? So is it because of the process design you have done, or is it because of this just reducing inefficiencies in general?
Eventually you get into a sort of chicken and egg problem, in that the assumption is that if you're on a very large program, things are falling apart and people are dying left and right. The truth is, if you are adhering to the quality standards from day one, then that is the only way you're able to scale to a situation where we can do nearly 40 cardiac surgeries, 45 cardiac surgeries in some days a day. So everything is attention to detail at the minutest level, which is having multiple checks and balances to make sure that patients are wheeled in, that we're operating on the right patient, that everyone is prepped and they have all the files beforehand, that the ICU has very low infection rates, that we have very low readmission. You can't scale unless you get your basics right. So the question is a little bit of the reverse. It's not that things break down at higher volume, that we can only reach higher volumes because we invested so much in doing things at very high quality standards from day one.
I have a question in regards to key challenges that Narayana Health actually faced in the initial phases of growth. Right now, I know it's a different story.
Yeah, I mean, just pick anything off a list. I mean, everything's a challenge: getting doctors, getting nurses, getting funding, getting patients to pay, getting land, expanding, convincing patients to come to us. There's nothing. If this were easy, everyone would do it, and then it wouldn't be a problem. Right? Yeah. So it's just this is a very challenging business, as much as it is the most rewarding, the most mission-oriented, and the most socially useful business. The biggest challenge that we are trying to balance the need to meet a society's demand for healthcare, which is essentially infinite, versus that same society's ability to pay for that healthcare, which is very constrained. Okay. You talk about a third world country, it's even more constrained, but honestly, it doesn't even matter. You can be the richest country in the world, and you still are not able to meet the needs of all the people in the US for the healthcare requirements, because like I said, needs are infinite.
And one question I had in India, how common is preventive care in terms of how well thought of it is like preventive care? Does Narayana Health involve a lot in preventive care?
We're involved in preventative care. Of course we are, and we run that across all our clinics. But if you would ask me, how much do patients or the normal person walking on the road invest in their own health and prevention? Very little is the sad truth. You take a survey of any company among a group of, take the most senior executives who have huge net worth, who have every incentive to stay alive and healthy because their shareholders and their bosses and their employees depend on them being alive and not, and being the most productive they are. And ask them when was the last time they took their checkup?
Absolutely.
In this country, healthcare is treated only at the point of a person staggering on their feet and just clutching their chest. That is healthcare. That is not healthcare. That is sick care. That is episodic. That is just when it is too late. Most of healthcare needs to be delivered well before that. When the arterial blockage was being noticed, when the waistline started to go up, when you turned 40 years old, when you got scheduled for your mammogram screening, that is when healthcare starts. Healthcare doesn't start the day you find a lump or you have your first heart attack.
I can't agree with you more, Shetty. I mean, frankly speaking, this is where the bulk of the spending goes into sick care. I mean, 2% investment in prevention probably can save 98% of healthcare costs overall. I mean, if we can do that properly. I just like to know more about the mission that Narayana has of eye care, and to provide care at a subsidized rate. How is this financially sustainable for the hospital? And you mentioned this briefly, to kind of subsidize, you basically, kind of make money on some and probably lose money on some. But in comparison, when we look at some of the other developed countries, how do you really think this is financially sustainable for some others who are not probably following as good a model as you are in terms of the volumes?
It is financially sustainable for us by virtue of that we're still alive and we're not bankrupt yet. And it is sustainable for other organizations. Well, the fact is that because there's still so much of shortage of healthcare supply in this country, there are not enough doctors, not enough nurses, not enough hospitals, that you end up getting monopoly sort of pricing. The fewer providers there are that are able to offer the best quality standards are able to dictate the price. All you have to do is just increase the number of doctors, hospitals, and nurses by 10 times, and then you start to see the prices come down for everyone. It's just that because we started from day one with the mission orientation, and obviously we could have raised our prices, done much more, shut down all our general wards and just refuse treatment to anyone who cannot pay the full price, is that we would not be able to sleep well at night having done so. And so with that as a limitation, we're the only ones who are willingly making less money for the same cost of infrastructure, for the same salary paid to doctors, for the same medical equipment found in our hospital versus somewhere else. The only place we would compromise, maybe our sofas look a little less nice and our floors are not as gleaming as everywhere else. While in every other metric, we are spending the same amount, but we're doing it at a lesser margin because we want to put the onus back on us to be more efficient and to still be sustainable at a lower price point to our patients.
So, in terms of if a hospital had to undergo complete restructuring and to adopt something what Narayana Health has done, would that be a possibility, or would they have to change everything?
Why would you need to? As long as someone is willing to pay 100, why would you make the same thing at 80?
Correct. Yeah. I must say, and I really commend the kind of model that you actually have built up. And I'm just talking about when we were actually at Max Hospitals, or for that matter, even Evercare and others. We saw that there was no rock star culture of doctors in the hospital. It's actually much more process oriented, much more about patient first approach, which is so important, to really drive value. And I think that's what probably also, in some ways, people are united with the mission, which I think is also important, because that helps us also to become, in some ways, stay true to what the original objective is. I'd just like to know a little bit more about, how do you see the overall health landscape changing, with the advent of new technologies, Gen AI, cloud computing, big data. If you could throw some light on that, that would be very useful.
So Dr. Shetty always says a solution is not a solution unless it is affordable. And so using that lens, if anything is presented to us, we would immediately reject it unless the case is made that this can help reduce your cost, make you more efficient, and allow us to reach out to more patients. So the first generation of digital innovations that came about, so let's say the internet and email, which was a massive innovation earlier on. So it allowed patients to send their files remotely, great. Immediate adoption. Something else that came about, let's say something in surgical robotics. When it first came, we looked at it, we said, okay, it is slower, it is much more expensive, and it has these disposable parts that increase the price for the patient. So no. And then we waited till the technology matured, then it became faster, it had faster turnaround times, faster discharge, and it started becoming a lot cheaper for the patient. Then we said, okay, now this is the point in which we invest in this. So with the things that you mentioned around big data, for example, we were one of the first hospitals to move our entire IT systems to the cloud. Why? Because we just did a very quick comparison. If we had to build that many servers, it costed X. If we had to move it all to the cloud, it costed half of X. Easy solution for us. Whereas with Gen AI, there are certain applications that make a lot of sense for us, certain applications that don't. So for example, we're using it in the image recognition. It is quite useful in helping doctors to annotate a lot of the notes in the radiology department. In other places, we're using it for filling out the EMR records, because doctors don't always write legible, complete notes, so they won't want to type, they want to speak it out. So using the conversational AI, we can interpret whatever they're saying and turn that into a note that they can very quickly approve on their phone without having to type out anything. So what that means is one hand is always free to do other work, and one hand can be used for putting in the data. So we adopt the technologies, whatever is there, as long as it is oriented around making us more efficient, reduce the cost, and it's better for patients.
Understood. So you're not looking at a Mercedes approach. You're basically not taking the next big shiny thing. You're basically looking at when the technology is matured, when it's actually right for the patient in terms of the costs and in terms of the outcomes. That's when you adopt some of those technologies, which I think is a very practical, very sensible approach. I would just probably kind of also talk about the fact that both, I think Dr. Devi Shetty is somebody I deeply admire, and yourself, I think you're fairly hands-on in terms of also driving technology or driving adoption, within the hospital and within the group. What do you think are the challenges that many other, hospitals, and also I would say, today we also have so much digital health technologies, startups that are basically coming up with all this. What do you think the challenges that the current healthcare system faces? Because adoption is quite low. I mean, you don't see as much adoption as you'd like to see, clearly.
Yeah. I would say the only challenge with digital adoption, digitization, whatever you want to call it, it is if an organization says that what I'm doing is what I'm doing, and all these digital innovations is this extra thing. It's this, appetizer, it's this dessert plate. I can ignore it. I can continue doing things as I've always been doing for the past 20 years. If you come into this with that attitude, it doesn't matter even if you had Bill Gates coming to your hospital to try and implement a digitization program for you, it will not roll out, you will not be successful. But if starting from the leadership level, all the way down to the nurse at the patient bedside, If they can be convinced and if they believe that whichever program you're going to implement, whether it's a simple EMR or whether you want to put in some GPT-powered chatbot on their phone, whatever you want to implement for them, if they truly believe that the way I work is going to change, I will no longer write things by hand. I will no longer have to go physically to collect the notes. I will no longer work in the way in which I've been used to for the past 20 years. And the digital transformation becomes the main thing. And everyone's committed to doing things in a new way. You can succeed in anything. So generally what I find in a lot of hospitals is that there is one very forgotten, very neglected, very abused IT department. And our digital innovation is housed in this IT department, and they get slammed and pushed and kicked around and just not given any amount of respect. You have to liberate from the IT department and put it in the main thing. So it becomes everyone's problem.
That's music to my ears because we face some of those challenges. And of course, we also navigated those, but absolutely true. I mean, how do we really bring, also the IT department to start playing a role in some ways, delivering healthcare, in the best possible way. And in some ways, leveraging technology in the right kind of form and format. Because I think a lot of times now, technology is even able to drive revenue. It's not only about just the back-end work that they were doing earlier. I'd just like to know a little bit more about the focus areas that you mentioned. I mean, for yourself and Narayana Health, also about, you talked about the fact that prevention, and that's where today it's all sick care. Are you actually wanting to look at that also as one of the focus areas beyond what you already are kind of currently driving?
In addition to wanting to make our hospitals 90% more efficient than what they are right now, the other big thrust for us is to move the conversation away from the hospital. The reason why very few people, even when they know or suspect they may have a problem, refuse to get treated, refuse to go proactively is because healthcare is so deeply, subliminally associated with going to a hospital and getting operated. And that is big, that is scary, and that turns off a lot of people. So they will delay that until it is too late. So if we want to liberate healthcare from the hospital and make healthcare less hospital-centric, then we have to go to where the people are. Now, a lot of digital tech startups will say, look, we can do it on the phone. Yes, but there's only so many things you can do on the phone. Another group of startups will say, okay, we can do it at the home. Yes, you can do some things at the home, but not everything can be done at home. Some people say we can do this in the clinic. Yes, there are obviously some things you can do in clinic, some things that's not possible. Other people say you don't need to do anything. We'll just take your blood sample, we'll calculate your genes, and an AI will tell you all of that. Maybe, but it's not yet proven to be the case. But all of them together is what we call integrated care. And that is something we're going to start building out in clinics across all the cities in which we operate, which combine online care, which combine stuff delivered at home, which combine clinics, which combine even some element of using AIs to figure out whether you might be diabetic or not. Awesome. And wrap that into one convenient offering, which is tied into an insurance plan that you buy. And so the two work very closely in conjunction. So you buy an insurance plan, which includes integrated care as an embedded offering. And so now the onus is back on us again. We will make sure you don't end up in a hospital. We will make sure you don't get the heart attack. We will make sure you get your test done on time. We will make sure that if you're an adult Indian male above a certain age, you will be on blood thinners or beta blockers or whichever based on your risk score.
Yeah, that's actually wonderful words. I had a question in regards to what challenges in India patients face when adopting digital health. Because as you mentioned, there's so many companies popping up in terms of telemedicine, then tele-wellness companies, so many things. So in terms from a patient's perspective, what do they really need and why there's a problem, a significant gap yet for healthcare delivery specifically?
See, because there isn't an iPhone moment for digital health. As much as everyone has invested in the UI and the attractive feature set and combining apps with take-home devices, we're still in the primitive stages of customers proactively coming and saying, I want this, I love it. My neighbor has it, because my neighbor has it, I want this thing. People hate having to buy glucometers. You can make the best glucometer app. You can have the most amazing UI for a connected scale. No one is saving up money to buy it. No one is going to buy the glucometer 12 Pro That does not exist in this industry. And until you get to that point, and I'm not saying that you need to consumerize it or make it, matte black and make it titanium coated. The point is that it is not attractive enough for the patient. There is a combination of messaging that has been put in. You had mentioned earlier about spending 2% to save 98%. So that is the money way of making it attractive. You spend less, so ounce of prevention, pound of cure. That's one way to put it. Or by embedding it into an all-in-one plan so that you don't need to ask for it. This will be done for you. So it's extraordinarily convenient. Or with enough messaging and marketing. Fortunately, post-COVID, a lot more people are aware of the health risks that they face. And they've seen a lot of colleagues suffer very badly because of COVID, because of pre-existing condition. And they started to wonder whether they have those conditions as well. So the overall level of health awareness is a lot more today than it was before. But we need this complete shift in everyone's perceptions about the tools that are available so that people actually call you and say, I want this thing. I want the latest version of this device that is going to prolong my life, make me live a happier and healthier way.
That's very nicely put, Stuart. And I must say, there's no iPhone moment yet in digital health. That's so true. That's amazing. Very, very nicely put. And I remember, and I think from our perspective also, we've seen this, before COVID, we actually had, we were running after doctors to embrace telemedicine, telehealth, and all of that. But after COVID, I think we've all known, how that has changed and transformed the way, technology has been adopted. And we saw doctors in the reverse, while I was at Evercare and Mitra, we saw them running after us to, get them on the telehealth platform. So it has been a shift. And I think it's a great momentum. What we need is to make things easier and simpler for the patient, for the customer, to give him that iPhone moment, to give him that ease by which he can probably embrace these technologies wholeheartedly. So absolutely true.
I also want to know about what is Narayana's health vision for the future in terms of expansion, in terms of where do you want to go, like in the next 50 years?
Maybe 20 years rather than 10 to 20
50 years. Great leaders have 100 years.
All of you is that we want to just transform our entire organization to becoming an integrated provider. For us, the most important thing is that all our hospitals work lockstep with clinics, with online consulting, with care coordinators, with nurses, with caregivers at home, so that a patient coming in to a hospital is not their first time. We will have known everything about them. When they come to our hospital, it will not be an unplanned, unscheduled visit. It will be a very deliberate process of years of effort that has gone in beforehand. And we've managed them to the best of our ability. And only when we have failed in doing that, do they end up in our hospital.
That's actually wonderful. One question I had also was, so you've been expanding globally in terms of right now you have a hospital in the Caribbean. Is your goal to be a hub of medical tourism as a potential revenue?
Or
Not
you
medical
expand
tourism.
to other countries?
Or you would like to expand to other countries, such as...
We do want to expand. Yes, we absolutely do want to expand to other countries because, as I was saying earlier, this is a global problem. There is not a single country in the world that has absolutely sorted and figured out their healthcare. And this is the one place where we go. It is as even a playing field as you can get. If you were to start an AI company today, obviously some American company will have a huge advantage as against a company coming out of somewhere in India. Right? Because they have more engineers, they have more money, they have more talent, more data sets. But over here, the raw material of healthcare is people. And in that, in India, we are unequally endowed with the benefit of working in a resource-constrained environment. That allows us to be more innovative, a lot more process-oriented, a lot more quality-oriented at a very low price, because this offering is common wherever you go. And so the skills and techniques we've built here is relevant to foreign markets. So we went to Cayman with the idea of doing medical tourism, which didn't work out. But we realized that everything we've applied allows us to be one of the best healthcare operators for the Caribbean population. And so we can scale that to other Western markets.
That's actually wonderful. So in fact, 4 years ago, I read an article on Forbes. It specifically mentioned that Narayana Health is the perfect model of healthcare delivery compared to the US model of healthcare delivery. They mentioned something about hub and spoke, but I really don't understand the idea of hub and spoke. I mean, I know there's a hub and there's spokes, but what is the difference between each hub and spoke? And is it even a model of healthcare delivery, or is just very.
It's an MBA term. It's something that sounds good in a consultant framework. It essentially means to have multiple points of entry for a patient. So if your hospital is in one part of the city and you need to treat a patient for a very simple thing, you don't need them to come to the hospital for all of that. You can get them treated in a small clinic nearby. So our hub and spoke model is essentially around having multiple points of presence where our customers are able to access different levels of healthcare depending on the acuity.
Yeah, and I must say that the point you mentioned about the vision to be connected care, continuity of care. And in some sense, we are actually saying what you referred to was actually true healthcare, not so much sick care. It is actually enabling the person to come on scheduled visits to the hospital. It is extending the care beyond the hospital to the homes, to the clinics, to the entire ecosystem. I think that's probably the vision that I think will definitely, excite and in some ways inspire millions of, patients and consumers, because to me, they also currently find the healthcare costs are not sustainable. Unless we actually have this kind of a model, it'll be very difficult for even governments, and I'm sure even patients to kind of support this kind of current situation. So again, I think I'm really, really fortunate to hear such wonderful insights.
Yeah, wonderful.
Yeah.
And according to you, personally, what do you think the medical education system needs to change in one thing, or how do they need to change in terms of to teach us to be better managers and to reduce inefficiencies?
Well, me as a non-doctor commenting on how doctors need to be trained would not be the most appropriate thing. I would say that the fact the field changes very quickly, and a lot of medical textbooks date back to the 1800s. So obviously the science remains the same, but its relevance to the field, it does sometimes feel like there is the whole body that you need to treat and not just the individual. I would say medical education has to be a continuous process. It can't be a system wherein which you are locked in an ivory tower for 10 years and you come out and suddenly have to face the world. I think it has to be made more modular. I think there need to be continuous learning elements to it. I think there has to be a huge amount of being able to work during your residency, not spending few hours, nearly spending the whole time, and have the entire curriculum delivered online and things that lower the cost of medical education, make it more accessible. See, forget Western markets, even in India, medical education, even though it's the cheapest in the world, it's still extraordinarily expensive because it's built around ivory towers. But healthcare doesn't always have to be done in an ivory tower. And so a hospital like ours, we treat huge number of the patients, more patients than most government hospitals, but we're not a medical college, right? Because we don't meet certain very strict criteria what constitutes a medical college. We could be. Any corporate hospital could be the best medical college. So to an extent, we can treat postgraduates, we can treat specialists, but at the undergraduate level, I think that some innovation does have to happen using digital tools that deliver curriculum independent of the bedside care, which a lot of doctors need to spend a lot more time on.
And if I may also share, frankly, the doctors that we see today, they already are in some ways much more conversant with technology. I mean, we've talked about digital immigrants. We know about digital illiterates. Now we have digitally, native, in a way, very, very digitally savvy doctors coming to the mainstream, which is great. So I see a lot of changes already happening, in the way doctors today embrace, let's say, systems, embrace electronic health records. It's much different. Of course, it's the duty and the, responsibility of the technology providers to make it simple and easy for them to adopt. And you rightly mentioned speech-to-text, recognition. How do you make it easier, for the doctors to embrace that? What do you do to make even radiology, maybe using AI to augment what doctors are doing today? Those are elements that we need to kind of bring to the fore. But doctors are already now embracing technology because they've grown up with it.
Yes.
It's so much easier
Yes.
in that sense.
Yeah.
So there's no question about it. But one aspect I do think there are some elements that probably we need to change in the medical education. For example, I believe there are only 4 hours of nutrition taught to doctors. I mean, they need to know more about holistic education, holistic health.
Yeah.
Those elements also, if hearing from the doctor's mouth, I'm sure the patient will listen much more. It won't happen otherwise. So those are elements that might need to be modified in that sense.
Yeah. So a very holistic approach to education must be taken seriously. Not only catering to the basic subjects, but also like wellness aspects, how to integrate alternative aspects of medicine as well. Maybe that they could gain understanding of that.
That's probably going to be slightly far-fetched, but yeah, I think there's definitely need to have a more integrated approach to what they do, interdisciplines, even between specialities. A little bit more of that ivory tower approach needs to kind of break down, because they do need to appreciate the patient as a patient. It's not about only a cardiac patient or a diabetic patient or whatever.
So if you had to give one piece of advice to the young doctors just finishing their med school, what would you say?
Or younger generation. I would say just younger generation.
Very younger generation.
I think healthcare is one of the most exciting fields to be in. Working as a young medical student, it's very easy to get overwhelmed because there's just so much work, there's so many patients, so many demands on your time. But it is rewarding across multiple spectrum. It is rewarding because you get instant feedback. Someone working in a very large software firm does a few changes to a bit of code. You don't know how much impact your work is having on society. Similarly, people working in finance, people working in consulting, marketing, not that the work is not socially useful, it absolutely is. But you don't get feedback from the end user about how good or wonderful the service you've provided is. So there tends to be this huge disconnect, and why people get burnt out and frustrated in other industries. Whereas in healthcare, you get it immediately. The patient survives or they don't. You'll know in a couple of days or weeks. And so it does deliver a lot more satisfaction. Furthermore, it is what the whole world is willing to shut down the global economy for 2 years to ensure that we continue living happy, productive, healthy lives. It was the healthcare scare that shut down the whole world. So it shows where the global priorities are. The global priorities are around everyone's health. So everything is aligned around that. But yes, you have to challenge all the orthodoxies. You have to keep working towards having the patients in mind. You have to keep improving health outcomes. And one of the big misnomers about people going into medicine is that people think the patients sometimes feel that they're only out to make money. That's almost never the case, because if someone wanted to make money, there are far easier ways to make money. You can make a lot more money working in finance. It's a lot less work and a lot less stressful. Because getting into medicine to make money is one of the most roundabout ways to do it. People come in with this element of service. The problem is when the system is not built around allowing them to perform at their peak and do the most good for the most number of people that are out there. For many reasons, for certain sorts of regulation, organization dysfunction, not being able to, having your hands tied, or a lot of internal hierarchy and politics, is how people get disconnected and not feeling like they're able to make a difference in the world. But there are good organizations out there, and it's up to doctors to choose the places where they put the most good out into the world.
Absolutely. And I must say, as a last point, at least my side, I think the ethos that you mentioned, united with the mission, to actually have a very clear purpose. I think that itself is a huge thing, to kind of get people a lot more energized, and aligned towards a common goal. I think that obviously is something which the younger generation also is looking for. They are looking for purpose. They are looking for a slightly higher vision than what we typically see. So that is very, very useful.
Yes, definitely. And one personal question: what was the best part about this whole journey in 12 years?
So actually, I've been working in this hospital since 2004. I took breaks for going to college. So it's going to be close to 20 years since I've been in this industry. I'm not treating patients. I'm not, directly responsible for any of that. So my experiences of this industry are always 1 to 2 or 3 steps removed. But the most rewarding part of all of this is going into our hospitals and seeing patients, walking around feeling happy and good about themselves and being able to provide services at a cost they would never have been able to afford anywhere else. And just knowing that we're providing something that no one else can at a price no one else can, that is one of the most fulfilling things about this job.
I must say I second that, because many hospitals across the world and India also are benchmarking them against Narayana Health, price benchmarks and total cost benchmarks. So kudos to you with that. Again, thank you so much. From both of us.
Thank you so much for joining us today. Any special words or any closing remarks that you would like to have for the world to know?
No, I think you're doing a good job. I think you're focus on, managed care, integrated care, the notion that healthcare needs to move outside of the hospital and work in a coordinated fashion. I think it's a valuable message that needs to go out. And I think a lot more people building healthcare companies of tomorrow need to think in that direction, not in this currently very siloed, single purpose approach, but to orient it more around what people want. And of course, on making things a lot more affordable.
Absolutely. Thank you so much.
Thank you so much for joining us today. It was one of the most insightful conversations I've had so far. Really appreciate it.
Thank you. And I think I must again say, I really admire Mr. Devi Shetty and his vision. I'm sure he's kind of given you such amazing values. So I really, admire that. And thank you again for all the good work you're doing.
Thank you so much.
Thank you so much.